Namaste. Hello everyone. I am Dr. Raj Palaniappan, Director in Chief of Bariatrics at Apollo Hospitals, Greensroad, Chennai. Today, November 26th, being Anti Obesity Day, I would like to thank everyone who has kept themselves fit. I'd like to congratulate everyone who have lost weight. And I would like to inspire those who wanted to lose weight for the future. Basically, we have to work behind a healthy world, a disease-free world. To have all these things, obesity is the biggest menace that needs to be addressed at this point of time, especially the kind of a juncture we are in with corona still not going out, a lot of restrictions in our physical activities, in our work related things, and too much homebound, trying to eat more, Swiggies and other stuffs coming up. We need to work around our health in a big way, and obesity plays a big role. This Anti-Obesity Day, I would like to give some 5 important points to the public to understand what exactly we are in a state or what exactly we need to do as well. Point 1, we are in a state of denial in our country, especially in Chennai, that we are becoming a sick country, especially when it comes to obesity. Though we are a developing country, we have a huge volume of obesity. The absolute number of obesity outnumbers the percentage of obese people in the US. So with more than 25% of population being on the obese side, we have to make sure that we address this on a war footing. Point number 2, childhood obesity and the associated diseases that obesity brings, which is called as a metabolic syndromes: sugar, BP, cholesterol, sleep apnea, some infertility in women, and of late male infertility as well because of obesity. Then arthritis, migraine, plenty, some cancers, especially the gastrointestinal cancers, breast cancers. There are a lot of diseases that comes along with it. Of course, because of these things, liver failure, cardiac failure, arrest, and early death are all common features that at the end of the day we are suffering because of obesity. 30% of diseases in the world are related to obesity, and obesity is the second largest cause of death in India behind cancer. Though obesity is a syndrome which causes or leads to a lot of complications, we don't address obesity as a disease and we think it's okay, it's related to prosperity in our part of the world. We have to really work on that, and we have to look into fitness and health in a big way. Plenty has been said about healthy eating during corona times, fitness and all those things. That helps you to understand, isn't it, that lung capacity is pretty important, and that lung capacity obesity reduces largely, causing a lot of problems. That's why corona is related to obesity as well. A lot of deaths and complications are due to obese people during the corona times. So you have to be a bit careful about obesity again. Point number 2, how to assess them. When it comes to assessment, there is no single parameter which is pretty straightforward to assess obesity, because it's a systemic disease we call obesity as, because it affects a lot of organs. It's a systemic disease, so it has to be having various parameters. So the first parameter what we use is called the BMI. We take your height and weight in kg divided by height in meter square. We arrive at BMI. That BMI between 18 and 22, if it is, which is called normal, these people tend to have least amount of disease and the longest lifespan. Once it grows beyond 10 kilos, that is a BMI of 22 to 27, we call this overweight, where there is some kind of a reduced physical activity, metabolism is deranged, but still you are comfortable running around doing normal life. But it crosses 20 kilos. When you cross over to obesity, there is 27 to 32, where we call moderate obesity. Some hormonal changes, enzymatic changes started happening in the intestine and the body that leads to more accumulation of fat. Then it becomes a cycle. You will be doing the same work like before, but you start gaining weight. That is when you have to catch yourself. Beyond 10 kilos, make sure that you lose the 10 kilos, because otherwise what we call as a set point, the body will set itself to a different set point of weight. 0 to 10 kilos, there won't be any change. Beyond 10 kilos, set up to a higher standard. Beyond 20 kilos, it sets up to a even higher standard. It's difficult to lose the extra 10-15 kilos what you have gained at that time. Then comes severe obesity. Severe obesity is beyond 25-30 kilos. At that stage, it's difficult to come back to normal because more than 50% of hormonals and enzymatic reactions come down, metabolism comes down, so it's difficult to lose more. So when it is easy to lose, 90% of people lose weight before 20 kilos. After 20-30 kilos, it becomes 20-30% can succeed by diet, exercise and changes. But once you cross that and go into 40 and 50 kilos, only 5 out of 100 will be able to lose weight. And these people get into a stage called as metabolic syndromes. Sugar, BP, cholesterol and other diseases, what I told you, these processes come in. So BMI, using the BMI, we can assess all these things. Second parameter to understand is basal metabolic rate. How much of a metabolism you do every day. The more the weight gains, the more the metabolism comes down. So the metabolism, it should be around 1500 for women and 1800 for men. If it is below that, you have to improve your physical activity to increase your metabolism. That is how we judge people whether to reduce their calorie intake because they are overindulging in food, or increase their physical activity because their metabolism is low, to address the weight loss. So that way these two are very major. Then we will what addresses the muscle mass and the percentage body fat. How much of muscle you have. The more muscle you have, the more you have metabolism, easy to lose weight and maintain them. If you have more percentage body fat, by increasing the muscle, the percentage body fat comes down. By exercising, you lose more fat, again percentage body weight comes, body fat comes down. So that balance of percentage body fat and skeletal muscle mass is a third parameter which we will assess. Beyond BMI, BMR and muscle mass and percentage body fat, we can also look into waist circumference, waist hip ratio. These are all the things. So if the waist is more than the hip, that means you have a lot of obesity in the abdomen, truncal obesity. The more the truncal obesity, the more the higher chance of metabolic syndromes, sugar, BP, cholesterol, liver, fatty liver and all those kind of things. The more you have them, difficult to lose, the more in a disease process, you reduce your lifespan. So these parameters as a number 3 point which I like to explain to all of you. Putting all the 1, 2 and 3 points together, you need to understand where we stand in obesity. We need to understand what are the issues that obesity brings, and we need to understand what are the ways you can assess your obesity. All these 3 things has to be scientifically assessed. So we don't want you to go to Google and do your own assessment and come to your own conclusion and judgment. Let us stop doing that. Let us go for some help from technicians, that is physicians. Come to us, meet some of your family physician or your colleagues or friends or known associate professionals, because assessing all of these by yourself is not a great idea, because there is some kind of a lacuna here and there, ups and downs in measurements. to work around what helps you, what not helps you, you need to have a physician's opinion. Post that opinion, then the point 4 and point 5 comes into act. Point number 4 is how to manage this obesity. When you talk about managing obesity, there are plenty of ways. You must have seen everything from Amway to Herbalife to cosmetic surgery to medicines online to gym to diet, in diet keto, so much other, and then the last bariatric surgery. Let us go one by one, what is what and what is helpful for you. For everybody, the most important thing is lifestyle changes. What do you mean by this lifestyle changes is diet, exercise and behavioral changes. Diet, we all know about it, that we need to lose weight means you need to control your calorie intake, reduce your carbs, reduce your fat, increase your protein, have a more proteinaceous vitamin mineral based diet. That means have a lot of pulses, cereals, green leafy vegetables, all those things helps you. Reduce your rice and wheat, reduce your non-vegetarian, especially mutton. You can take a lot of fish, egg and chicken if you want to. So work around more protein, normal fat and low carb diet can help you, as well as timing of food. Don't skip breakfast, don't eat heavy dinner, have dinner before 8 o'clock and have a semi full lunch. So we say have breakfast like a king, have lunch like a staff and have dinner like a pauper. Play this around with kind of a good balanced meal for Indians. You will tend to lose some weight, but our body is too smart. The more you reduce the calorie, at one point it stops reducing it. So you might not lose beyond a stage. So to maintain the weight loss or to lose further, you need to add exercise. So diet, then exercise. Exercise does two big advantages. One, it increases the muscle mass. The more muscle mass increases, the metabolism increases, the basal metabolic rate increases, along with the calorie burn due to exercises. So you lose calories by exercise as well as increase your muscle mass with increase in the metabolism. So it helps you to lose more as well as to maintain the weight loss. So to maintain the weight loss for long term, exercise along with the diet is a must. Otherwise, the diet you take like keto, paleo, GM and whatnot, everybody is muscle slimming exercise, weight loss. You lose weight, but you lose muscle also. The more you lose muscle, the more dangerous it is because your metabolism goes down. Tomorrow when you eat normally, you gain weight, but you gain only fat. So you need muscle to maintain the metabolism and maintain the weight. So don't go only by exercises. I am personally against all this keto, paleo, all the diet, GM diets. Try to take a balanced meal, high protein based meal. You will be perfectly alright as long as you continue with the exercise as well. Third, the behavioral change. When it comes to behavioral change, what we expect is to change the timing of eating, timing of sleep, stress, all those things. So as I told you, have a good breakfast, semi-full lunch and a half-full dinner before 8 o'clock and don't skip your breakfast. That's about the eating thing. Second is sleep. Sleep for 8 hours, minimum of 6 hours is a must. 8 hours is a good one. Don't have any TV time for 1 hour before sleep, because the more TV time you have, the less the secretion of melatonin, you reduce the sleep time. You have very disturbed sleep, you have shallow sleep. So you should have a good sleep, a good food, good sleep, reduce your stress. Try to have some activities done every day so that you will work on some kind of a stress buster. Play with your kids, have some game, you can go out. So, but in Corona times it's not easy to go, but then things are changing. Now you see the whole crowd is normal. Do all those things to reduce your stress along with a good activity, good diet and some kind of a walking here and there, some activity change. It's called behavioral change. These three put together is a lifestyle changes which helps you in every single case. And only if you follow these things, we can maintain the weight loss for a long time. Otherwise, you can lose weight for 1 month, 2 months. But you don't do these things, you will gain back again. That holds good for everything, even for surgical scenario. Next comes medications. When do you need medications? When the lifestyle changes is not helping you, then you need some more help, support to push the weight loss. During those times, you need medications. Or if you are in the moderate to severe obesity, you are 15 kilos, 20 kilos, 25 kilos overweight, where diet exercise is not helping you to push more, you can add them to help it. So there are plenty of medications available in the market. Few of them are non-FDA approved, that is not approved by the governments. Few of them are approved by the governments. Try to take as much as possible the government approved drugs. Again, all these drugs are only going to help you only if you have your lifestyle changes done. If you don't do lifestyle changes and you want only medicines to work, I don't think it will work for longer. It will work for a month or two, it will not work beyond that. Sometimes it will not work at all. So medicines are to help you. If you think you can lose 30% of weight through diet, exercise and lifestyle changes, by behavioral changes, adding medicines will help another 20%. So you will help to little bit more weight loss. But if you are beyond 25-30 kilos, even those might not help. Or if you are irregular, not religious with your weight loss, then you might not lose the other ways as well. So then what? If medicine is not helping, you have to move to a next level, either a surgical scenario or there are some wellness centers like Zindal and a lot of places around where they give some kind of a restricted diet, have some yogas, meditations and some kind of a nice activity based works and some Ayurvedic medications which are really helpful to lose weight. Again, caution, a word of caution there. All those things are temporary. As long as you don't diet and exercise continuously, you will not be able to maintain the weight loss. And of course, medications have a lot of side effects. Some have kidney effects, some have effects with their, with depressions, some will have mood elevation, some will have, plenty of activities, plenty of side effects. So medicines have to be cautious, and similarly, having the wellness center or things have to be cautious. It's good for a short while if you're going for holidays, if you're going for a marriage, all those kind of things. You can lose some good weight, 5 kilos, 7 kilos, 10 kilos in a month, and then just go ahead with your activities. But once you come back, you will gain again. So be careful. This waxing and weaning, that is up and down in weight, gives a lot of hormone change in the body, and there will be a time when nothing will work for you. If you go beyond that, what shall we do? So if lifestyle change is not helping you, medicines are not helping you, then wellness centers are not helping you as well, then we'll go with what we call as a cosmetic surgery, liposuction, tummy tuck, those kind of things. Or go to slimming centers where they do electrical or ultrasonic waves called laser lipo, cryo lipo, all those kind of stuff. What will they do? These kind of activities, they will help you to burn some extra fat and absorb them so that you lose 2 to 3 kilos in one sitting of your activities. Otherwise, liposuction will again take 3 to 5 kilos. Tummy tuck 7 to 8 kilos. But if you're 30, 40 kilos overweight, will they help you? No, they can't help you. But you are going under the knife, under anesthesia, you are increasing your risk multifold for a small amount of benefit. So, these cosmetic surgeries are all body contouring procedures. They are not weight loss procedures. So, you need to understand that weight loss is very important Of course, yes, but not by doing a body contouring procedure to address a 30 kilos, 25 kilos or 40 kilo weight loss. That they are helpful when you are fit, when you have maybe arms are more, only abdomen is more, thighs are more, bum are more. We can do all those tummy tuck, arm tuck, butt enhancing or butt reduction, whatever, breast reduction. So all those things are possible only if you are fit and you have some issues with the one compartment of your body. Beyond that, they should not be doing these kind of things if you are beyond 20 kilos, 30 kilos overweight. But in spite of that, a small breast reduction surgery, especially for male breast reduction surgeries, they can motivate you to be more active, and suddenly people can change to weight loss by exercises and lifestyle changes and diets. So this can be motivational, inspirational, but then they are not scientific treatments for weight loss. What to do next? If you are 30, 40 kilos overweight with sugar, BP, cholesterol, so much of a problem, so that your lifestyle is not good, you are mostly homebound, or you are not able to take care of your health properly, sugar is uncontrolled, those kind of people where their lifestyle is affected because of obesity, those people deserve what we call as bariatric surgery or metabolic surgery, depending upon what the problem is. If weight is the only problem, then we choose bariatric surgery, where the weight loss is a part of the surgery. If you have uncontrolled sugar, BP, cholesterol, thyroid, infertility, all those kind of issues, then we call them a metabolic surgery. That's a different group of surgeries which addresses these metabolic syndromes majorly, and weight loss is a side effects along with it. So what do you mean by these procedures? Bariatric and metabolic surgeries. These are all procedures which will help you to lose 70-80% of weight loss. That means if you are 40 kilos overweight, you lose 30 kilos out of it. That's a huge weight loss. How will happen? It will happen by various mechanisms of intestine and stomach restrictions, and digestive issues are changed. With this kind of a thing, there are three ways: restriction by reducing size of a stomach, malabsorption by reducing absorptive capacity, and satiation, reducing the hunger factor. You feel full pretty early and feel happy eating food very, very early. These three mechanisms. So there are various procedures to do these three mechanisms. You all heard about stomach stapling or sleeve gastrectomy or a gastric bypass. There are plenty of other procedures like one anastomotic gastric bypass, single anastomotic sleeve ileostomy, single anastomotic duodenal ileostomy, intestinal bipartition, plenty of procedures, around 9 to 10 procedures we have. All those procedures are tailor-made to individuals' need depending upon their weight, their comorbidities, their lifestyle, all those things, and the deficiencies they have as well. Using these parameters, choose the right procedure. We will do on them. Bariatric people will lose the weight, metabolic people will lose weight as well as their disease process. As I told you, 70 to 80% weight loss is possible by bariatric surgery. By metabolic surgery, close to 80 to 90%, sometimes even 100% resolution of disease process of sugar, BP, cholesterol, thyroid, joint pain, sleep apnea, infertility, polycystic ovarian disease, migraine, few cancers. Most of them can be gone. Lifestyle diseases, most of them can be gone when you lose that much amount of weight as well. Irrespective of weight loss also, there are some procedures where you lose because of the hormonal changes. There are 203 gene mutations that happen after surgery that help you to do the hormonal and enzymatic changes and change your whole perspective towards weight loss. This is why we need to change the mindset of people who think by restriction weight loss happens. No, we change the hormonal pattern, and that helps in weight loss and control of comorbid diseases. That's why we are moving away from calling this a cosmetic surgery, which is a misnomer, which is wrong. Even the government has changed to a essential gastrointestinal surgery, or called as a metabolic surgery. So these are all these treatments what we have to do weight loss. Post surgery, there are few things we need to understand as well. Everything has side effects, so does surgery. Diet, exercise has side effects of weaknesses, muscle loss, and all those things. Exercise has a weakness of bulking up, going out of shape. Then you have to continue this, otherwise you'll gain the weight again. Medicines have side effects of kidney problems, sometimes mental issues, sometimes digestive issues. Cosmetic surgery has a cosmetic disfigurement and relapse of the weight. Same way, bariatric surgery has some side effects as well. They have nutrition deficiency and of course surgical complications of leak, infection and bleeding. Surgical complications mostly are managed easily if it's a good surgical team and knows how to do bariatrics or metabolic surgery. But post bariatric nutrition depend on two things. One, how the body of the patient responds. Second, how much you got counseled about it. If a body responds poorly, you have to increase the dose of multivitamins and proteins, especially B12, iron, calcium and protein has to be replaced. If the patient is not compliant, they are not taking the multivitamins properly, then also it can be a problem. So it can be a surgical issue, whether wrong surgery or too strong a surgery, or the patient not compliant with it or not counseled enough properly by the surgical team, then you will end up having nutrition deficiencies, which can lead to dryness of skin, hair loss, weaknesses, fainting episodes, vomiting. So those kind of things, if done the right team, this doesn't come at all. Only 4 to 5% of people have some issues. Otherwise, it is pretty much safer. And of late, the complications and mortality, that is death due to this bariatric surgery, has come less than 1%, which is very, very low compared to more than 1.5 to 2% in any other surgical scenarios. So it becomes that simple nowadays. So you don't really have to worry, but again, a good team and good assessment is very important to understand and work on it. Having said that, the whole gamut has to be tailor-made depending upon individual needs. No one person suits one procedure. Just because you are 40 kilos doesn't mean that you need surgery. Or just because you are only 15 kilos, you cannot say that this just need lifestyle changes alone. There are plenty of factors that decides what it is. So get the right help at the right time. We are here to help in all the counts. Ask us for it. We will give you suggestions, we will give you solutions, and you can go ahead and do whatever you want to do. But there are two important points. The last fifth point is how to do all these things. As I told you, meet a physician who help you with making the right choice. Never ever think bariatric surgery is not a right choice. Bariatric surgery is a right choice for 90% of the individuals if the indication is met. Only 10% of people it might go wrong here and there, but again, even in this case, only 1 to 2% have problems. Rest 8% also will be manageable. So in my opinion, 98% of people who are indicated for bariatrics, they do very well, provided right assessment, right team and the right procedure is done. If done, perfectly fine. So meet somebody who gives the best treatment. Again, how it is done again, the government itself is promoting it nowadays. All the central government and state government schemes approve bariatrics anymore. Recently there is even a Supreme Court verdict saying that bariatric surgery is not cosmetic, so it is a gastrointestinal corrective surgery or called a metabolic surgery done as a life-saving procedure in most of the time. And to top it all, now insurance is also covered. Come from 1st October 2020, all insurance should cover bariatric surgery if the premium categories are met. So there is no indication for them to reject bariatrics if all the guidelines are followed. And there are guidelines where you have to recommend these surgeries, and if that is followed, you are reimbursed as well. So with the government approving bariatric surgery, insurance companies agreeing to pay up the procedure fees, it's the right time to hit a physician to work on your weight loss, if necessary, bariatric surgery if you are indicated. So, putting all together, this Anti-Obesity Day, November 26th, I plead to all the Indians and everybody all around the world to take care of your body, because it takes care of you for 70-80 years non-stop. Think about one organ failing. You will have plenty of issues, but you are failing the body. What are we doing back to the body which is helping us for 70-80 years non-stop? Help us help you to get your body fit and healthy so that it performs to the 100% potential, if not 70-80% of the potential. Don't kill it by giving only 40-50% potential, by putting on weight, eating unhealthy food and all those kind of things. So keep yourself healthy. If you need help, call us. Ask. We are almost more than 450-500 bariatric surgeons around the country, and more than 1,000 nutritionists and weight loss professionals around the country. Get a scientific professional help, then you go to your local team and get yourself sorted out. This Anti-Obesity Day, especially because of the corona times, I request all of you to take a pledge for a obese-free world, at least a healthy 2021. Jai Hind.